All right, today we're going to dive into a really fascinating medication called Dantrolene. And this one, well, it kind of has a double life. On one hand, it's a superhero in the operating room during a major crisis. And on the other, it's a steady, helping hand for people dealing with chronic conditions every single day.
So I want you to picture this. You're in the OR, a patient is under anesthesia for a totally routine procedure. Everything seems to be going just fine. And then, bam! Out of nowhere, their muscles lock up, completely rigid, and their body temperature starts to skyrocket. I mean, dangerously, life-threateningly high. So what in the world is going on?
Well, this terrifying event is called malignant hyperthermia. It's a really rare genetic condition that gets triggered by certain anesthetics. The body's metabolism just spirals completely out of control. And let me tell you, without incredibly swift intervention, it is often fatal. This is the exact moment when our story's hero has to step in.
And in this story, that hero is Dantrolene. This isn't just an option. It is the specific, targeted antidote for malignant hyperthermia. But how does it work so effectively? What's its secret?
Okay, so the key is that it's peripherally acting. Now, what on earth does that mean? Well, most muscle relaxants you might think of, they work on the brain or the spinal cord, the central command center. Dantrolene's different. It bypasses all that and goes straight to the source, the muscles themselves. It directly stops those violent contractions, breaking that dangerous chain reaction.
And this is where you really see its versatility. In an emergency, it's given through an IV for a super fast, life-saving response. But for patients who already know they have a risk, they can actually take it as a pill for a day or two before surgery to prevent a reaction from even starting. So it's both a rescue and a shield. Pretty amazing.
But Dantrolene's story doesn't end in the OR. Not at all. It also plays this incredibly vital role in helping people manage long-term conditions.
Yeah, Dantrolene is also prescribed to help ease the painful muscle spasms that come with conditions like a stroke, spinal cord injuries, multiple sclerosis, and cerebral palsy. It offers a completely different kind of relief, one that's about long-term support.
So for these patients, it's less about that one single dramatic life-saving moment and more about improving their day-to-day quality of life. By relaxing those constant muscle spasms, it can help improve mobility, independence, and just overall comfort. And that is huge.
But like any really powerful medication, Dantrolene has potential risks. There's always a but, right? And it requires some very careful management from both healthcare providers and patients. You have to read the fine print.
So let's take a look at the most common side effects. First up, muscle weakness, which, kind of makes sense. It is a muscle relaxant. You can also get drowsy or dizzy. Diarrhea can be an issue, especially when you first start taking it. And then there's the most serious potential side effect, the one we really have to watch: liver toxicity.
And this is exactly why professional monitoring is absolutely crucial. Doctors will keep a close eye on the liver with regular blood tests. To manage drowsiness, they'll usually start with a low dose and increase it gradually. They'll also frequently check muscle strength to make sure the relaxation effect is helpful, not harmful. It's a real balancing act.
Okay, now for a really critical safety warning. We have got to talk about drug interactions. Because with Dantrolene, some combinations can be incredibly dangerous.
These are the big ones to be aware of. Mixing it with CNS depressants, so things that slow down your brain, like alcohol, can lead to excessive sedation. Combining it with certain blood pressure meds called calcium channel blockers can cause serious heart rhythm problems. And for women over 35 who are also taking estrogen, there's an increased risk of liver toxicity. This is why it's so important to tell your doctor about everything you're taking.
So, what does all of this mean for the person actually taking the medication? Let's go over the safety playbook for anyone on Dantrolene. Here is your personal 5-point safety checklist. It's pretty straightforward. 1. If you feel unusual muscle weakness, tell your provider right away. 2. If you feel drowsy, please do not drive or operate heavy machinery. 3. Absolutely avoid alcohol and other CNS depressants. 4. Let your provider know if you develop diarrhea. And 5. Watch for any signs of liver problems, like stomach pain or a yellowing of your skin or eyes. That's called jaundice.
And finally, it's important to know that Dantrolene isn't for everyone. It's what we call contraindicated, which is a hard no for people with active liver disease. And it needs to be used with extra precaution in people with heart or lung conditions, other neuromuscular disorders, and in anyone over the age of 35 because of that increased risk of liver issues. So, when you boil it all down, is Dantrolene a life-saving hero or a high-risk tool? Well, the truth is, it's both. In the right situation, it is an absolute lifesaver.
but it's a tool that always demands respect and very careful management. And that duality really illustrates the delicate balance at the very heart of modern medicine, doesn't it? Where the greatest benefits so often walk hand in hand with the greatest risks. Thanks for joining me.